Hi, I am Dr. Stephanie Ezebuiro. I am a primary care provider here at Mahaska Health. I chose family medicine because it gives me the opportunity to see newborns and as well as an opportunity to see adolescents. It gives me an opportunity to see women of childbearing age, do prenatal care, and it gives me the great opportunity to see senior citizens. So I just like I can see everybody, pretty much. That's the reason I love family medicine, and that's why I chose it. I chose to practice at Mahaska Health because I have a heart for rural health. I was born and raised in Washington, D.C., so at heart I am a city girl. I lived 2 years in Atlanta, Georgia, so I was definitely different for me, a new normal, I should say, but honestly, I want to be ingrained, so I thought going the rural route would be the best route. And I met with the Mahaska CEO, met with Dr. Brian, and it just felt like a perfect fit for me and my family. I enjoy working at Mahaska Health because I get to see different patients from every walk of life. I enjoy that my colleagues are welcoming and warm, and I feel like I'm coming to work every day to work with my family. The most rewarding part about being a provider is you get to see people from different walks of life. And when I say that, what I mean is, on an average day as a human being, we have a tendency to stay in our comfort zone. We have a tendency to gravitate towards people who are similar to us and like us. But as a provider, several barriers are broken down, and you see everybody, whether it be different cultures, ethnicities, colors, languages. So I love that because I'm human and I have a tendency to gravitate towards people who are like me. But as a provider, I have to be different. I have to be neutral. I have to see everyone. And that allows me to come out of that comfort zone and experience other experiences that are unlike my own. So I enjoy that, and you get to help people. The way I would describe my healthcare philosophy is prevention is better than cure. That's another reason why I chose family medicine, because I get to walk with you and try to prevent diabetes, try to prevent hypertension, try to prevent strokes and heart attacks. Prevention is better than cure, as simple as that. My past healthcare experience includes, I did several years of volunteering at Children's in Washington, D.C., which I truly enjoyed and kind of opened the door for medicine for me. And I said, wow, this is probably something I would love doing full time. I went on to University of Maryland, College Park for my undergraduate degree, go Terps. I had the illustrious opportunity of doing medical school outside of the United States. I went to Antigua. Great experience. 2 years on the islands. I can't trade it in for the world. I did 2 more years of clerkships in Atlanta, Georgia, which I truly enjoyed. And then I found myself here in Iowa, and I went to a great residency out in Des Moines called Mercy One Residency, Family Medicine. The one experience that I've had that really opened my eyes to medicine was when I was a freshman at the University of Maryland. I took my freshman year summer to go to Costa Rica and Nicaragua. And that experience was to do medical missions. So while I was in Costa Rica and Nicaragua, I had the great opportunity. I don't speak Spanish. I probably speak minimal Spanish, despite 4 years of high school Spanish. I only speak minimal. So when I was in Costa Rica and Nicaragua, all the patients spoke pretty much Spanish. So there was a lot of pointing and trying to figure out what was going on. But I met an older gentleman who probably was in his 80s, and it was Mother's Day that day that we were holding our clinic. And he came in and said that he hasn't been able to eat. He's feeling weak and tired. And what was behind that was the fact that his wife had died some years back, and he went to her gravesite to celebrate her on Mother's Day, and he forgot to eat and drink and, was kind of dehydrated. I didn't think I had a lot to offer because at that time I wasn't a provider. At that time I knew nothing about, what to give him and the services he needed. But all I did was listen. And for him, that was more than enough. So we were leaving on a big old yellow school bus going back to our hotel, and he was outside waving under the tree with a white flag just to make sure that we knew that we made a difference in his life that day. No, I didn't give him medication. No, I didn't give him fluids. all I did was listen, and that was enough for him. So that was a rewarding experience for me that kind of tailored my path after that, you know, medicine probably, although it's a journey of a lot of years, a lot of stress, but the people you get to meet along the way, the patients you get to, you know, be a part of their family and just listen, was worth the while. So I enjoy doing a lot of things outside of work, including dancing. I enjoy spending time with my family, but another big part of my life is volunteerism. I love volunteerism. While I was in high school, my friends and I created an organization called Big Hearts. You know, at 18, you didn't know how much of a difference you can make in the world because you're 18. But we sold candy bars, we sold Cinnabons and things like that to raise money for kids in Kenya who were affected by HIV/AIDS. Maybe not directly, but indirectly, being that their parents may have had it. We were able to afford to fund 10 children a year of schooling, their clothing that they needed, the supplies they needed for schooling. So that was when my volunteerism was kind of birthed for me, the idea that I can make a change even in my own little way. So while I was in college, I joined Building Bridges. And Building Bridges was the opportunity I had to go to Costa Rica and do medical missions. And now my husband and I have another organization called My Neighbor, My Hero. And the idea with this is to minister to people the love of Christ, but at the same time to also take care of their healthcare needs. So it's still in its early stages, but I'm sure we're going to take it to touch the world in a big way. Now that you've gotten to know a little bit about me and my passion and my journey to this point, I would love to get to know you. So you are welcome to come and see me.